Spring is finally here, and with that has great opportunities for outdoor activities. However, should you do a pregame check? That is, are you wearing the proper gear? Are you eating the right foods and taking safety precautions before, during, and after exercise? Dr. Dinesh Dhanaraj, an orthopedic surgeon and sports medicine specialist from St. Mary Medical Center, is here to help us gain a better understanding of all this and more. I'm your host, Margie Zimmerman, and this is Beyond the Stethoscope. Well, welcome to Beyond the Stethoscope, Dr. Dhanaraj.
Thank you for having me.
Oh, it's our pleasure. So I'm hoping spring will be here soon. And with the nice weather, people want to get outside, get active. Adults, we have kids doing all types of sports now. So what are you seeing, and how can you prepare us?
Yeah, I guess as we were on the tail end of the skiing and winter sports injuries, we started to see people outside more, and they're getting out and about. Baseball, spring training, even outdoor soccer in the spring, track and field, golf. People are outside more, and so it definitely has its own set of unique injuries that people do when they're out and about in the sun.
So can you give us some guidance or some tips on, what people should do to take precautions so that they don't get hurt, and maybe, good activity for adults to get into, that, it can prevent them from having any injuries?
Yeah, I know. People try to just get back into these sports, golf, and even take up running and things like that in the spring. You always have to condition. You have to kind of get ready for it by training, by making sure that your body is ready for this because we've all been kind of hibernating through the winter, and to just get out there and go 100%. Sometimes you need to ease back into things. Is my main advice for this.
So
Spring.
stretching and stretching exercises and everything
Exactly. The,
like
the
that is
stretching
important.
is very important. I wish as life goes on, we got more limber and more flexible. We don't. So
That's not the case.
yeah, it's not, unfortunately. So we have to really kind of counteract that as the, winter months end and we start to do more things outside.
Yeah, absolutely. Okay, so I know what I want to do, and I'm excited to jump right in. What's my next step? I'm assuming I need proper footwear and protective gear, but what else?
Sure. I think you hit the nail on the head with the footwear. If you're getting out and about, like track and field, walking, people are outside more. You can't just pick up your old winter shoes and do the same. You need to probably invest in a pair of good running shoes or walking shoes that don't have a lot of mileage on them to make sure we don't have any of these overuse and type injuries that can happen with footwear that's worn out and things like that. And then any other sports you go into, the golf and things like that, you would want proper shoes and footwear and anything like that. And baseball, the protective equipment, the helmets, the pads, those are all important that you have to just make sure that you still have them and
Yeah,
they're
they're in good
up to
shape.
par. Yeah, exactly.
Oh, good. We hear all the time that exercise is a foundational element of healthy lifestyle. How does getting your heart pumping and legs moving translate to better health?
Great question. I love this question because it's not intuitive, but in medicine, the father of medicine, Hippocrates, his main quote is walking is man's best medicine. So the body's a machine. We have to rev the engine. We have to keep it moving. Otherwise, things go wrong. You start to have pain somewhere. You have these injuries. So just getting moving, getting the body strong again. You have to do these things before you go into any sport. You can't really just run off on a sprint in day one. You have to start to put some effort into just I hate to say the boring kind of conditioning exercises that are always important for the body, just for us to stay upright.
And walking. That so for someone that can't do too many play sports,
Sure.
walking's a great exercise. Even if you can't
Absolutely.
walk too
Yeah.
too fast or run, it's still getting your body
Just
moving. That's
getting out
important.
there, getting the body moving, the joints, they work better when they're moving. Sedentary lifestyles have been shown to just cause more issues with, the joints, with blood flow, even systemic diseases, So just getting upright, getting your body moving. We weren't meant to be sitting all day is the key. So 100%, if you can't do any sports, getting out and walking in the spring weather is fine too.
Yeah, I'm sure everyone's looking forward to it. I know I am. Okay, Dr. Dhanaraj, this sounds great. especially seeing that exercise can help reduce disease risk and improve certain medical conditions. However, I have to think that some patients may need to take extra precautions before starting an exercise program. How do you partner with your patients to help them set realistic expectations, stay diligent, and have fun for the long haul?
Yeah, it's a good question. It's a tough question we always talk about in the office, and patients are like, "It's spring, I want to lose weight for the summer, so I'm going to get out there and run on the track." And I'm like, "That's not always the best bet." In terms of weight loss, sometimes just plain diet is more effective, or just as effective as exercise. So we tell them, make sure you're not neglecting those things and try to just pound the pavement right off the bat. Sometimes you wear out your knees faster than you lose the weight, so you have to really balance what you do for the patient, for the particular patient, the body style. So I hate to say, not everyone can keep running into their 60s and 70s. It's just not meant for the body in certain aspects, in certain individuals. But you have to figure out what's better. Sometimes I tell patients, if you're a runner, now become a walker or become a cyclist. Try to incorporate some non-impact to
So
really,
they're not always running to do
yeah,
other things
get
with
more
it.
mileage out of your joints.
I know the runners, they're serious, and I think about their knees in the future because they
100%.
just
I
run
envy them, but
nonstop.
yeah,
I know, I do too. I
it's
wish I could keep up with
I hear
them.
you. I'm in the same boat. Not for
What are
me.
some of the most common injuries you see, and what can we do to prevent them?
Well, in terms of the knee, I pretty much one of the most common surgery I do is a partial meniscectomy, which is for torn meniscus in the knee. And the meniscus is the cushion, the shock absorber that cushions us when we walk. So inevitably, if people are getting into things too quickly or not listening to their body and pushing through pain and things like that, you can have a meniscus injury that may require a surgical intervention. Not all the time do they require it, and you can kind of push through it with physical therapy and
Mhm.
modification of
Oh,
your
really?
activity.
Okay,
Yeah,
so surgery's not
not
always
always. Yeah,
necessary.
but if you can prevent it, it's
That's the
obviously better.
that's the
That's
best.
the key.
I think everyone would prefer to prevent it.
I totally agree. Some of these are just in the overuse category. And going back to what I said, choosing the right exercise or sport or activity for the patient is key into preventing those things.
Absolutely. And what fitness activities do you enjoy doing?
Well, I wish I enjoyed more personally. Now with 3 kids running around and
Oh,
work, it's
yeah,
tough.
yeah.
But
That's
I'm
your
in this, yeah,
exercise.
that's my exercise. But I'm in the same boat. I force myself to try to get and do some exercise, a couple days a week, whether it just be, I do try to jog on a treadmill or lift weights. I try, but I'm not good as I should be, and even stretch. Back pain is something common with everybody, and the only way to prevent it is to try to do some core activities, including planks, side planks, those kind of things. I try to do them, not as best as I should, though.
So, how do you feel about strength training? Is that also important? I've been reading a lot about that. The strength training in itself is
Yeah,
really
loading
good.
the joint, loading the musculature, it does help the body. So, especially the core. The core is something we neglect. It's just the body musculature in near the abdomen and even the low back. We have to do exercises that help support our core and our trunk because it's a kinetic chain. All these kind of stability aspects of the joints, the knees, the ankles comes from the core, and even throwing a baseball comes from the
Right.
core. So,
So important.
it's very important to not neglect the core.
Yes. Well, Dr. Dhanaraj, thank you so much for joining us today. We appreciate your tips on keeping us fit and healthy, and we look forward to seeing you again. Thank you
Likewise.
so much.
My pleasure. Thank you.
As we learned today, exercise has many important benefits, and spring is the perfect time to get out and experience them. Thank you all for joining us today. Please stay tuned for future episodes of Beyond the Stethoscope.